Hi, I'm John Freitag. I'm with All American Hospice. I'm here today with Rory English. He's the Senior Regional Director for FOX Rehabilitation. So thanks for joining us, Rory. Thanks for taking some time out of your schedule. I'm sure it's been pretty hectic for you.
My pleasure. Thanks for having me.
Thanks. So Rory, the way I usually like to start off is to talk about you and why you got into working with seniors. How did that start?
Yeah, so by trade, I'm a doctor of physical therapy. When I first wanted to become a physical therapist, much like probably most folks in the field, I grew up loving the Philadelphia Flyers and the Eagles, and I applied to PT school in hopes to be the next physical therapist for the Philadelphia Flyers. During my application process to Temple University, I had the good fortune of working as a physical therapy aide at an outpatient clinic down on the main line in Montgomery County. And the clinic primarily saw older adults, which was a population I was relatively unfamiliar with from a clinical setting, outside of my own grandparents, really. And there, I got to meet so many amazing people and work with them, help them achieve their goals, goals that were things that I realized I took for granted every day. In particular, I'll change the patient's name for HIPAA purposes, but there was this one gentleman, we'll call him John, no pun intended, John, that he had an unfortunate fall on the ice. Prior to this, was a very active older adult. The fall resulted in a fracture in his cervical spine, and his main goal was to be able to walk his granddaughter down the aisle in the spring at her wedding. And the hard work that this man put in and how meaningful it was, even just telling the story again, gives me goosebumps. It was such an honor to be a part of his journey back to something that I think we all take for granted, being able to walk and help. Being a part of that journey meant so much to me personally. And that's kind of where I started falling in love with working with the older adult population. And then I was fortunate in my journey at Temple University to have some great mentors in Dr. Steve Karp and Dr. Mary Sinnott and Dr. Tim Fox that furthered my passion and interest in working with the older adult population. So from PT school, I came right to FOX Rehab as a new graduate. And I've been with the practice now for 7 years. I started out doing house calls, working out in private residences of our older adults up in Montgomery County. And the practice has been really kind to me, and through a lot of hard work, I've been able to grow with the practice from a staff clinician doing house calls to becoming more prevalent and a leader in serving senior living communities in Montgomery County, then transitioning to FOX Optimal Living Rehab Director over at the Birches in Newtown. And then growing on to a regional director and eventually senior regional director role, where I have the privilege of working alongside and leading 7 teams from Northeast Philadelphia up through the Lehigh Valley in our mission to end ageism and serve the older adult population.
That's awesome. That's an incredible journey, and I think you put it really, really well. And things that we take for granted. So
yeah,
just being able to walk, or just being able to have some sort of function or range of motion in, like, your arms, and just bend and lift and do those types of things. That's stuff that we do every day, and you don't even think twice. And
absolutely, and it's so important, not just the physical aspect of being able to do those things, the psychological component that goes along with it. Historically, medicine has done a really good job of adding years to life, right? What do those years look like? No one's really taken a step back and thought about the quality that exists in those extra years. And at Fox, we've really taken it upon ourselves to focus on the quality of life and really helping folks. One of our slogans is help them achieve what they once thought impossible. There's a lot of misnomers or misinformation about aging, and accepting the fact that just because we get older means we can't do what we want to do and love to do. And we're really here to say that's a crock of BS, and you should be able to do what you love to do and do things that are meaningful to you, no matter your age. They may look a little different over time, but achieving them and finding a new way to kind of do those things is so important. And part of being a physical therapist is really connecting with your patients to ascertain what's important to them, right? Coming to a patient in their home in particular and seeing what they want to accomplish is the best way to help them be successful in the rehabilitation. Unfortunately, there's a lot of physical therapists or physical therapy out there that strives towards predetermined markers and never really ties it to something that's meaningful to the patient. Do they want to be able to get up and down from the ground, be able to play with their grandkids, great grandkids? Do they, play organ at their church and they need to get back to that? Do they really love going out to eat and having, they must be able to fold up their walker and put it in the back seat of their son-in-law's car. Those things are all
really individualized goals that you work towards.
Yeah, absolutely.
Yeah,
absolutely.
You put it really well too. Again, that like psychologically. So I'll give you an example. In the beginning of quarantine, the beginning of March, everyone's staying at home. I started doing some walks and stuff with my kids around the neighborhood. And I went to impress them one day. I brought my skateboard, and I'm 36 years old. I shouldn't be on a skateboard, right? So pulled off a couple ollies, and then the last one I did, I fell on my back for like, no lie, 3 weeks. I couldn't move in the morning without hurting. It would take all day to get stretched out to be able to move, and then the next day you're starting back over. And I try to be really active, and I'm always working on things, whether moving around, running around doing marketing, or just fixing things around the house, or working on something, and not being able to do that freely without being in pain was a huge thing that I wasn't used to.
Yeah, there's a definite, especially with aging, as we lose function, it's often overlooked, right? Older adults are forced into this role of a loss of function, or forced to often, not always, but sometimes forced to give up these life roles and give up these things and accept that, hey, someone's just going to do that for you now. And oftentimes, with a little work of physical and occupational therapy, we can figure out a safe way to accomplish that, or get the right muscles stronger, improve the balance to help them do it the way they used to. So many people just get written off because of their age, unfortunately. And to your point, like there needs to be a happy medium there. And there's a psychological piece associated with grieving the loss of function, right? You would grieve it almost like the loss of a loved one, something that's near and dear and important to you. It can be super depressing to have to be dependent on anybody else, right? When you're historically the breadwinner or the go-getter in your family, or you take a lot of pride in being independent and autonomous. And I see it so often. You see these folks that are, the last thing they want to be is a burden on their families. Especially men, we just tend to be a little bit more stubborn and asking for help, and we wind up putting ourselves in bad situations that are preventable. So being proactive and navigating that, and understanding, like we only at FOX, we only work in geriatrics. So understanding that, how to unpack those emotions that are totally normal part of this process of where we would engage someone and where we would be indicated, can really help us be successful in figuring out their why.
Right. That's awesome. So it's like a really holistic approach. You're looking at the person physically, obviously, but also mentally, and just figuring out what their goals are and how to achieve them, with maybe they're not going to be able to do it the same as they did 20 years ago, but figure out a way to make it work. What's that, body mechanics?
Yeah, it's super important. I think those connections really help people be more successful, I think, and understanding that the rehabilitative road of a 92-year-old might not be the same as a 74 versus a 47-year-old, right? So we're unpacking a lot. There's a lot of different stuff going on in most of our patients.
Yeah. So I know you guys mainly from the nursing facilities. Like you said, you're over at the Birches. You're at a lot of facilities in the area. But you also, it sounds like you do a great deal at home. So you're working with individuals at home.
Yeah, absolutely. So Fox was founded in 1998 in Cherry Hill, New Jersey by Tim Fox. And that was really where we got our start. Dr. Fox had recognized that he was working at a skilled nursing facility at the time, and he just kept realizing that the system was failing. He kept seeing the same people over and over again. He's like, what is going on? How are these people living if they keep winding up back here, and what's the quality of life in that? So he took a look at the Medicare Part B outpatient regulations and saw that year there was a change in the regulations that allowed for care to be provided by an outpatient provider either in the private residence of an individual or in an outpatient facility. Your brick and mortars, your ATIs, your NovaCares that we've all seen, up and down the East Coast and throughout the country. So from there, we had the novel idea of kind of taking healthcare back to what it used to be, and the practitioner engaging the patient in their home setting. And as a clinician myself, I gotta say it's my favorite way to deliver care. It really is insightful for us, having practiced in acute care and an outpatient setting as well. There's nothing left in my imagination, right?
Right.
In an outpatient or acute care setting, you take a history from a patient and you kind of assume that they're telling you the whole truth. And, there are 4 stairs. What I picture in my mind might be 4 stairs that are up to code, sturdy with a sturdy railing.
Yep.
And in some cases, it's not entirely true, right? So going into the home is a really great privilege for us. It really allows us to see the whole picture. It's really extremely convenient for our patients. And it really allows us to continue the good work that's done in a skilled nursing setting and a home health setting, right? So as folks are discharged, oftentimes they'll get discharged from home health and be instructed to go to an outpatient center. And for whatever reason, it may not be their speed. They may want to go and work out in a gym with 8 other people at any given time. So they kind of fall through the cracks and only get as well as home health gets you, which is
right.
But sometimes it's not entirely good enough. They need that extra step in the continuum.
Mm-hmm.
So from there, that's where we can kind of come in and work our magic. And and through our partnerships with senior living communities as well, we really look at and view that senior living setting as their home, right? So their dining room, their bathroom, their apartment, their common areas where they go to activities, just as important as a regular private residence in order to focus on goals that promote engagement, happiness, success, and functional independence, because that will allow them to age in place longer and not have to, potentially move out to a higher level of care in a skilled nursing facility down the road. It allows them to stay in one spot and have that more home setting in the assisted living or personal care world.
Right. No, I know. I mean, we see it in hospice, just people, they want to stay put, they want to stay where they're at, especially these assisted livings or personal care homes. People are spending a lot of money in their gorgeous places, and they want to be able to get the full use out of them, so they want to be able to get up and get out of their bed and get out of their room and hang out with their friends,
Yeah, that's huge. The socialization piece is critical, right? So the nice thing about personal care, assisted living, memory care is that it's a home setting. It's not a clinical setting first, right? Whereas in skilled nursing, folks are far more clinically complex. It's a clinical setting really before It's a home setting, right? And having a foot kind of in both worlds of seeing people in their private residences and in personal care, it's eye-opening. Really, one of the nice things about what we do in serving both of those populations is we can be a part of some tough conversations sometimes with families of, mom or dad maybe needing just a little bit of extra help to keep them safe and improve the quality of their life. So it puts us in a position to really work closely with our senior living partners to make that referral. Hey, why don't you go visit our friends down the road and take a look at this personal care community? We really think it would meet your needs. And a lot of what I see, man, the socialization aspect of it is huge. So living on your own in your own private residence, there's a lot to be said for that. But it's also isolating, especially in the midst of everything going on in the world right now.
Yeah.
One of the really just tremendous added benefits of senior living settings is the socialization, the friends, and the relationships you build with your neighbors. And it facilitates a camaraderie and engagement. Really, studies consistently have shown that it improves your cognitive function the more folks you interact with on a regular basis. So it's a no-brainer, really.
Right. Yeah. And I mean, you bring up, the current situation with coronavirus, COVID-19.
Yeah.
How's that affecting you guys? I mean, I know from the hospice standpoint, we were having issues like in March, I guess, when everything sort of came to a head. A lot of facilities weren't letting us in the building. It took a lot of finagling to be able to get them to, even allow nurses in. Was the same sort of thing happening to you guys?
Yeah. Certainly the restriction of access, completely understandable in certain instances. And I know there's a lot of uncertainty on the federal, state, local level. That was challenging to navigate this, particularly in March. We've been fortunate that the folks who we partner with in the senior living world have been very understanding and worked with us. And really the foundation has been good, clean, clear communication of, how we are preparing our clinicians to keep not only our clinicians safe, but the residents and the staff at the senior living communities safe. So there were a few that restricted access, and again, completely understand what's at stake here. But at Fox, we've really taken the step to go above and beyond CDC regulations to protect our clinicians and our patients. So we're doing the screenings and the temperature checks. Our clinicians are checking their temperature twice a day. Additionally, we implemented the utilization of face shields or goggles and surgical masks on our clinicians at all times, really. Even if, there's not an indication that COVID may be present in that person that they're treating. And additionally, when tolerated, we've been placing surgical masks on our patients to really protect both parties, right? Mm-hmm. Because we really felt that it's important to maintain someone's functional wellness as this is going on into its almost fourth month now. We have seen social isolation and functional isolation where the radius of the person's world that they're engaging has significantly decreased, right? And unfortunately, it leads to big functional changes, which can result in falls and hospitalizations. And we firmly believe that we can deliver good clinical care with that PPE to help prevent unnecessary hospitalizations at this time, really as a bridge over troubled water, so to speak. And because for a while there, maybe as hospitalization rates are starting to decrease, which is a good thing, but rolling the dice to wind up in a hospital emergency department, probably one of the last places you wanted to be in March, just because of the unknown, right? Yeah. So if we can prevent that, now more than ever is the time to do it.
Right. So what's therapy look like at a facility? I know you brought up the face shields and the masks. I know some facilities have, some therapy rooms, some are bigger than others. Are you guys still utilizing the rooms? Are you going just room to room? How's it?
It's a great question. Yeah. So out of an abundance of caution, we've really, as you mentioned, we do rent therapy spaces with some of our partners, and we've got nice, beautiful gyms that are right now kind of a reprieve for our clinicians, right? Kind of be a storage point for their personal items and kind of like a spot to check in. It's kind of like a safe space for them right now that they can engage at their convenience. And our patients are primarily being seen one-on-one in their rooms at this time, rather than in a setting where, sometimes in our therapy spaces, there can be 2 or 3 patients working with 2 or 3 clinicians, right?
So just trying to minimize interaction for everyone.
Yeah. But as we get back to normal, we're constantly reevaluating how we can deliver good quality care and keep it safe and effective. So no firm plans yet to really open back up our spaces for treating patients outside their rooms, but we're working closely with the experts to make sure that when that time comes, it's done.
Yeah, you want to do it safely. That makes perfect sense. Is there anything that you guys have done, anything that you've implemented due to COVID-19 that you feel is really working great, that would actually something that you want to carry over, post-COVID?
Yeah, I think it's a great question. I think ultimately we have seen a lot of efficiencies improve internally, right? Efficiencies in our clinicians in their scheduling and the way they kind of route their days and weeks in coordination with our senior living communities. as partners, and it's really strengthened the bonds that we have built, right? Having consistent staffing, one of the things we really focused on, it's always been a policy of ours, but we stood by even firmer through these times, is the dedicated staff to a community, right? So that the patients really know who our team is, and our team really knows the patients. And the same goes for the executive directors and wellness directors in these senior living communities. It really allows us to deliver good, consistent clinical care, decreasing traffic through the community, and there's just a good partnership that develops from that relationship locally, and good, strong communication. And then the other thing that's come from all of this is how we engage technology, and how we engage, particularly through telehealth. We started doing telehealth as well as the Medicare regulations have loosened up in the outpatient world. It's a great tool to have available to us. It's certainly not appropriate for everybody, every patient, but in certain instances, it's a great way to engage patients that maybe are a little apprehensive around.
Right.
A lot of some
people out there. Yeah. We've seen the same thing about they don't want AIDS or something coming out to the house because they're nervous about getting, sick. So, I mean, it's got to be great for, just diagnosing on the fly. Just someone has a small issue, they can explain to you face to face and show you stuff instead of just over the phone. So, no, that's great.
And it's a really great tool to reinforce home exercise programs, right? The homework people to really, in a manner that's safe and effective, right? There's a great deal of clinical decision making that goes into when we use this tool, but being able to have them demonstrate to us digitally how they perform their home exercise program and their compliance with it has been insightful.
Yeah, that's great. Well, Rory, thank you so much. Thanks for taking the time, and thanks for explaining everything and what you guys are doing over at Fox. I know you guys have a great program, and from what I see, you guys do amazing work.
Thanks, Sean. I appreciate it. Likewise.
Thanks. All right. So I guess I'll share your LinkedIn information in the links below. And, if anyone needs to reach out, you can find Rory there. So thanks again.
Absolutely. Thanks so much, man.
Thanks.
Take care.